Sponsored by RxCardClub.com. Get a free prescription drug card and save up to 85% on prescription drugs. RxCardClub.com. Ozempic Semaglutide Subcutaneous In non-human animal studies, semaglutide was shown to cause thyroid Ccell tumors in rodents. However, it is unknown whether this risk applies to humans. Still, semaglutide should not be used in people with a personal or family history of medullary thyroid carcinoma or in people with multiple endocrine neoplasia syndrome type 2./r/n/r/n-Ozempic. Semaglutide is a prescription drug used along with diet and exercise to manage blood sugar in people with type 2 diabetes. It is also used to lower the risk of major cardiovascular events, such as stroke or heart attack, in adults with type 2 diabetes and heart disease. /r/n/r/n-Ozempic is not insulin. It works by helping the pancreas release insulin when blood sugar levels are high and preventing the liver from making and releasing too much sugar. Ozempic also slows food movement through the stomach, reducing appetite and resulting in weight loss. Ozempic is in a drug class known as glucagonlike peptide 1, GLP-1, receptor agonists. /r/n/r/n-Ozempic is available as a subcutaneous injection, meaning it is injected under the skin. /r/n/r/n-Generic NameSemaglutide /r/n/r/n-Brand NamesOzempic, Wegovy /r/n/r/n-Drug availability, prescription /r/n/r/n-Administration RouteSubcutaneousrnrn/n/r/n-Therapeutic ClassificationAntidiabetic /r/n/r/n-Available Generically No /r/n/r/n-Controlled Substance N/a/r/n/r/n Active Ingredient Semaglutide /r/n/r/n Dosage Forms, Solution /r/n/r/n The Food and Drug Administration, FDA, approved Ozempic Do, /r/n/r/n Ozempic does not treat type 1 diabetes. It has not been studied in people with pancreatitis, inflammation of the pancreas. /r/n/r/n Very well, Dennis Madambarnrn r/n/r/n Before starting Ozempic, read the patient information leaflet with your prescription and ask your healthcare provider or pharmacist any questions. /r/n/r/n Make sure to take this medication as directed. People generally start with the lowest dose, which gradually increases as instructed by their healthcare provider. However, you should not change your dose of Ozempic without talking to a healthcare provider. /r/n/r/n Ozempic is a subcutaneous injection. This means that it is injected under the skin of the thigh, upper arm, or stomach. People typically inject their dose once a week on the same day each week. A healthcare provider will show you where to inject your dose. /r/n/r/n When using Ozempic, remember to /r/n/r/n The ingredient in Ozempic, semaglutide, is also available in tablet form under the brand name Rybelsus and as another injection form under the brand name Wegovy. Do not use different kinds of semaglutide at the same time. /r/n/r/n Ask your healthcare provider how often you should check your blood sugar. If your blood sugar gets too low, you may feel shaky, hungry, or dizzy. Your healthcare provider will tell you how to treat low blood sugar, usually with a small amount of apple juice or fast-acting glucose tablets. Some people also use prescription glucagon in an injection or nasal spray to treat severe low blood sugar emergencies. /r/n/r/n Keep Ozempic in the original packaging in the refrigerator, protected from light. Do not use an expired or frozen pen. /r/n/r/n You can reuse the pen several times with a new needle for each administration. Never reuse the injection needle. After using the pen, Remove the needle and place the used needle in a sharps container for proper disposal. Sharps disposal containers are generally available through pharmacies, medical supply companies, and healthcare providers. According to the FDA, if a sharps disposal container is not available, you can use a household container that meets the following requirements: /r/n/r/n. Once finished with the pen, put the cap back on and put it back in the refrigerator or at room temperature. Keep it away from heat or light. Throw the pen away 56 days after the first use, or if less than 0.25 mg/mg is left, as shown on the dose counter. /r/n/r/n. Keep Ozempic away from children and pets. Never share an Ozempic pen with anyone else, even if you change the needle. /r/n/r/n. Healthcare providers may prescribe Ozempic for off-label uses, meaning for conditions not specifically indicated by the FDA. Semaglutide is also sometimes prescribed to help people manage their weight in combination with diet and exercise. /r/n/r/n. After the first dose, it takes 1 to 3 days for Ozempic to reach its highest levels in the body. However, Ozempic does not reduce blood sugar at its starting dose. You may need to assess your blood sugar levels after 8 total weeks of treatment. If the dose at this time isn't working, a healthcare provider may increase your weekly dose again. /r/n/r/n. This is not a complete list of side effects, and others may occur. A healthcare provider can advise you on side effects. If you experience other effects, contact your healthcare provider. You may report side effects to the FDA at fda.gov/medwatch or 1-800 FDA 1088. /r/n/r/n. The most common side effects of Ozempic are stomach problems such as /r/n/r/n. Other side effects include /r/n/r/n. Call your healthcare provider right away if you have serious side effects. Call 911 if your symptoms feel life-threatening or if you think you're having a medical emergency. Serious side effects and their symptoms can include the following: /r/n/r/n. In some cases, long-term side effects may occur. Some possible long-term side effects may include /r/n/r/n. Report symptoms to your healthcare provider or seek emergency attention if needed. Call your healthcare provider right away if you have signs of a thyroid tumor, including /r/n/r/n. Ozempic may cause other side effects. Call your healthcare provider if you have any unusual problems while taking this medication. /r/n/r/n. If you experience a serious side effect, you or your healthcare provider may send a report to the FDA's MedWatch Adverse Event Reporting Program or by phone, 800-332-1088. /r/n/r/n. Ozempic is available as 3 different pre-filled pens. Each strength is color-coded as follows: /r/n/r/n. Your doctor will start you on a low dose of Ozempic for the first 4 weeks of treatment. This way, they can see how well Ozempic is working for you. After this, your doctor will likely increase your dose. Your adjusted dose will depend on your blood sugar levels and other factors. /r/n/r/n. Each red pen can deliver 4 0.25 mg starting doses and 2/2 mg maintenance doses. Your healthcare provider will likely prescribe this strength as your first pen. /r/n/r/n. The red pen can also deliver 4/2 mg doses, so you may use this pen for your maintenance dose. /r/n/r/n. Each green pen delivers 4 1 mg doses, and the yellow pen contains 4 2 mg doses. If your dosage needs to be increased, your healthcare provider may prescribe either of these pens. /r/n/r/n/r/n/r/n. In some cases, it is necessary to modify, or adjust, treatment with Ozempic. Some individuals may need to use caution when taking this medication. /r/n/r/n pregnancy/r/n/r/n. There is limited data on Ozempic use during pregnancy. /r/n/r/n non-human animal studies showed that semaglutide exposure might potentially harm fetuses. However, these studies are not an alternative to studies in humans and do not necessarily translate to human use. /r/n/r/n If you are pregnant or planning to become pregnant, consult your healthcare provider for medical advice. You may need to stop taking Ozempic at least 2 months before you want to become pregnant. People of childbearing age should use effective birth control while taking Ozempic and at least 2 months after the last dose. /r/n/r/n breastfeeding /r/n/r/n Consult your healthcare provider before using Ozempic if you are nursing. It is not known if Ozempic passes into breast milk. /r/n/r/n age /r/n/r/n Some adults 65 or older are more sensitive to Ozempic. In some cases, starting at a lower dose and increasing it slowly can benefit older adults. /r/n/r/n If you miss a dose of Ozempic, administer it as soon as you can within 5 days after the missed dose. Then, resume the regular once-weekly schedule. If more than 5 days have passed, skip the missed dose and resume your dose on the regularly scheduled day of your dose. /r/n/r/n Overdosing on Ozempic can cause nausea, vomiting, or low blood sugar, hypoglycemia. Based on your symptoms, you may receive support treatment. /r/n/r/n If you think you or someone else may have overdosed on Ozempic, call a healthcare provider or the Poison Control Center, 800-222-1222. /r/n/r/n If someone collapses or isn't breathing after taking Ozempic, call 911 immediately. /r/n/r/n It is very important to carefully follow any instructions from your healthcare team about the following. /r/n/r/n Ozempic is not appropriate for everyone. /r/n/r/n You should not take Ozempic if you /r/n/r/n Ozempic may be prescribed with caution in some people if your healthcare provider determines it is safe. The following circumstances may require you to use extra caution when taking Ozempic. /r/n/r/n Ozempic can cause low blood sugar. Taking Ozempic with other drugs that lower blood sugar can increase the risk of hypoglycemia, low blood sugar. A dosage adjustment of the other medication, such as insulin or other medications used for diabetes, may be required. /r/n/r/n Other medications that lower blood sugar include /r/n/r/n Because Ozempic delays gastric emptying, it can affect the absorption of oral medications. Ask your healthcare provider how you should time your other medications when taking Ozempic. /r/n/r/n When taken with Ozempic, some drugs can increase the risk of kidney problems. These medications include /r/n/r/n This is not a complete list of drug interactions. Other drug interactions can occur. Tell your healthcare provider about all the medicines you take, including prescription and over-the-counter drugs and vitamins or supplements. This ensures that your healthcare provider has the information needed to prescribe Ozempic safely. /r/n/r/n Ozempic is in a class of medications called GLP-1 receptor agonists. Ozempic contains the ingredient semaglutide. /r/n/r/n Semaglutide is also available as an injection under the brand name Wegovy for weight loss and as an oral GLP-1 receptor agonist to improve blood sugar control in type 2 diabetes as Rybelsus. /r/n/r/n Other injectable drugs in the GLP-1 receptor agonist class include /r/n/r/n A variety of oral medications are available to help control blood sugar in adults with type 2 diabetes, including /r/n/r/n People with type 2 diabetes may also need injectable insulin to help control blood sugar levels. There are various types of long-acting and short-acting insulin. /r/n/r/n. This list is a list of drugs also prescribed for type 2 diabetes. It is not a list of drugs recommended to take with Ozempic. Ask your pharmacist or a healthcare provider if you have questions. /r/n/r/n. Ozempic is an injectable medicine used in combination with diet and exercise to improve blood sugar control in adults with type 2 diabetes. Ozempic can also reduce the risk of heart attack and stroke in adults with type 2 diabetes who have heart disease. /r/n/r/n. Ozempic is an injectable medication, but it is not insulin. Ozempic helps the pancreas release insulin when blood sugar is high and prevents the liver from making and releasing sugar. Ozempic also slows the movement of food through the stomach, which can aid in weight loss. /r/n/r/n. Some drugs, like insulin or certain oral medications for type 2 diabetes, interact with Ozempic, increasing the risk of low blood sugar. A dosage adjustment may be required. Other drugs in combination with Ozempic can increase the risk of kidney damage. Talk to your healthcare provider before taking Ozempic to ensure it is safe with the other medicines you take. /r/n/r/n. One dose of Ozempic reaches its highest levels between 1 and 3 days. The first 4 weeks of treatment, at 0.25 mg per week, do not lower sugar. After 4 weeks, the dose is generally increased to 0.5 mg weekly. After 4 weeks of this dose, for a total of 8 weeks of Ozempic treatment, blood sugar levels can be analyzed. Sometimes, the dose of 0.5 mg weekly is sufficient to control blood sugar. In other cases, the dose needs to be raised to 1 mg weekly. Your healthcare provider will advise you on a dosing schedule. /r/n/r/n. The most common side effects of Ozempic are stomach problems. These may include nausea, vomiting, diarrhea, constipation, stomach pain, burping, gas, acid reflux, or indigestion. /r/n/r/n. Severe allergic reactions are rare. Seek emergency medical help if you develop hives, difficulty breathing, or swelling around the face, lips, tongue, or throat. /r/n/r/n. Your healthcare provider will advise you on how long to take Ozempic. /r/n/r/n. When taking Ozempic, follow your healthcare provider's instructions for use. Read the patient information leaflet with your prescription and consult your healthcare provider if you have any questions. /r/n/r/n. If you have never given yourself an injection, it can be scary at first. A healthcare provider, nurse, or pharmacist can show you how to administer Ozempic and provide training materials. Bring a family member or friend for support and training if possible. /r/n/r/n. Give yourself plenty of time to prepare the injection and administer it yourself. Once you have done the first injection, it only gets easier. In a few weeks, you will not even remember that you were once nervous. /r/n/r/n. Prepare a kit with supplies that you take with you at all times, including the following items. /r/n/r/n. It is also a good idea to wear a medical alert bracelet or necklace, which alerts emergency responders that you have type 2 diabetes. /r/n/r/n. Ozempic should be used along with diet and exercise. Talk to your healthcare team about what diet and exercise regimen you should follow. Monitor blood sugar as directed. Before taking Ozempic, discuss all medical conditions and medical history with your healthcare provider and tell them about your medications. This helps ensure that Ozempic will be prescribed safely and that your healthcare provider can monitor you appropriately during treatment. /r/n/r/n. Very well, health drug information is meant for educational purposes only and is not intended to replace medical advice, diagnosis, or treatment from a healthcare provider. Consult your healthcare provider before taking any new medication. /r/n/r/n. rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.